Well, good morning, Neomed. It's a pleasure to be with you this fine summer morning. I have very few updates as things are in a bit of a slower period at the university, having finished with our commencement and preparing for the beginning of our next semester. We did have a board meeting, the Board of Trustees, since our last update. And in that meeting, our Board of Trustees approved our 2022 fiscal year budget. I'm meeting with small groups of individuals across the university to discuss the details of the budget and the impact that it will have on our employees. That impact is all positive. We've been able to engineer pay increases, incentive performance bonuses, and other improvements to compensation and faculty and staff development that I think everybody will be pleased with. So I want to thank our Board of Trustees for working through that process with us and ultimately for approving a budget that's going to be very beneficial to the university. The details of that will be shared with all of you at the town halls. I've already held 3 town halls and we have many more scheduled for the next 1 to 2 weeks. As an update on COVID-19, we've had 1 positive case since the last time that we met, and that was in an employee. Apparently that individual is doing fine. We'll share with you that our choice program that we rolled out approximately 2 weeks ago has been very successful. We've learned that now about 75% of employees at the university are fully vaccinated and many more are in the process of undergoing vaccination. So our numbers will continue to climb. And I'm sure that this is part of what we're seeing across the state of Ohio, where we are now below 50 cases per 100,000 individuals averaged over 2 weeks. And in fact, the last 7 days, the average reported currently on the website is 388 cases, which is dramatically down from the close to 12,000 we were at during the peak of the surge. So we are continuing to make progress. We have one way to really prevent this from bouncing back and being a problem, and that is getting vaccinated. So I encourage all of you to please get vaccinated. It is the one thing that we can do to keep this campus safe and completely return to normal. The choice program that was rolled out is a mandated reporting program where our employees and our students have to choose between either showing proof of vaccination or declaring that they are either not going to be vaccinated or not show proof. We do not ask to differentiate, simply the choice of showing proof of vaccination or choosing not to. For those of you who do show proof of vaccination, there will be no restrictions on this campus. We will otherwise be back to a return to normal compared to pre-pandemic policies and procedures. For those who choose not to, you are going to be required to wear a mask while indoors on campus or congregating in groups outdoors, and to follow social distancing guidelines, and will continue to undergo the governor's request for testing. We made this decision several weeks ago. Interestingly, it aligns perfectly with the new higher education COVID-19 guidelines that have been released by the Center for Disease Control. Those were released on June 4th, and those noted that a fully vaccinated campus, which also includes the fact that there will be some individuals who either have religious or medical reasons for not being able to be vaccinated, can return to no restrictions. However, a non-fully vaccinated campus will have restrictions, including face masking and social distancing. So we are continuing to be in compliance with federal guidelines and, of course, with state law. I do encourage all of you to become vaccinated. Again, this is what is allowing us to return to normal on this campus. We continue to offer vaccines to the campus at the pharmacy. I believe these are still being done on Thursdays. Dr. Kazmer's team will continue to send out information on availability. We have many local partners who are also offering vaccine. Right now, the demand is far less than the supply of vaccine that is available. We're all working hard to prepare for the beginning of the fall semester, which will begin for our College of Medicine in late July and our College of Pharmacy in early August. This things never really stop, though. We've got our clinical students, both in pharmacy and medicine, continuing to progress and advance into their next year. And we have our students in the College of Graduate Studies who are continuing to conduct research towards training either in master's degree programs or to become PhD scientists. We're also expecting to hear from the Liaison Committee for Medical Education sometime in the next 10 days to 2 weeks. We certainly will know by the end of June what the outcomes of our second site visit will be. We're feeling fairly positive about the results, but we won't know until those results are released. And when we do, we'll make them broadly known and available to the campus community. Many of you know that we stood up a new clinic on the second floor of the medical office building back in November. We are hoping to fully operationalize that clinic to be able to serve the community and our employees sometime in July. We are still working through some last minute details regarding the electronic health record system, as well as the coding and billing systems that need to be in place for insurance provision. At this time, we are still taking care of students. Summa Healthcare, as you know, is going to be expanding and is expanding on our campus. We expect them to have a 20,000+ square foot footprint. At this time, we understand they'll be offering urgent care, cardiology, orthopedics, endocrinology, psychiatry, family medicine, and also corporate health, and potentially a number of other specialties on our campus. They have announced they're planning a grand opening in September, on September 11th. It's a Saturday. We'll let you know more details as that evolves, but we would love to have as many of you as possible here on campus to support that opening when it does take place. And then finally, the Summer of Wellness is continuing to be underway. I hope you're enjoying the time allocation you've been given to focus on your health and your wellness on a weekly basis with paid time off of work. And I ask you to continue to focus on safety, as summer months are at a time when we have increased levels of injuries due to summer activities. That has really been demonstrated in some of our local hospitals, which are seeing an increase in the number of trauma admissions that they're experiencing. So please be safe, look out for yourselves, and look out for each other. With that, I'm going to stop and I'm going to open it up for questions.
Yes, the first question is for those of us who are able to attend the town halls, when will we find out about budgetary decisions and other changes affecting pay and performance review?
I'm sorry, Michael, one more time. You said for those who are attending town halls or those who have attended?
Those who are unable to attend the town halls.
So we will also be sending the information out directly through HR. And in fact, that should be happening very soon. I'll work with Mr. Andre Burton on ensuring that we get that out. The town halls are really just presenting the information that we already know to be factual and in place, and giving you direct presentation and an opportunity in a small forum to be able to ask those questions. But that information will be going out. If it hasn't already, Mr. Burton, let's make sure we get that out sometime in this week.
Where will the Summa footprint be located? And also, is there a time frame for the takeover of the pharmacy from Summa?
Well, the concept of the takeover of the pharmacy is still evolving. There is no signed contract stating that that is happening. I believe there's interest on both parties for that to occur. So we'll have to hold off and see where that progresses. It's a little premature right now to state that they're going to be taking it over until they're completely comfortable with the assets and how that would take place. But right now, that is not something that's fully cemented. It's being explored. The Summa footprint currently going to maintain where they're at in the new center with corporate health and with primary care. and the entire bottom floor of the new medical office building, the last building to be constructed. As you're coming into the main entrance, it's just to the right. That area where Welty Construction is currently working is going to be where Summa Healthcare will be. They're planning both an urgent care center with extended hours into the evening, as well as subspecialty care.
The next question, what would be the difference between care provided at the clinic you mentioned and the Summa Care medical offices currently active?
So Summa also offers primary care. We will be offering primary care. Our hope is that we will be able to offer a very immediate and personalized care for our employees and our staff. We will plan on sending referrals to our Summa Healthcare partners downstairs from our facility. So it will be done as a partnership endeavor with them, but really this is meant to be a personalized, attentive program for faculty, staff, and the local community. The ability to get in quickly, to be seen ideally within an hour, if not for sure within the same day, so that there's not long appointment lags, and trying to find better way to improve access and quality of care. So ultimately, yes, you'll be able to go to the primary care offerings if you're with Summa Insurance in their facility. For those who are also with Summa Insurance or other types of providers, you will have the ability to come in and get access to the clinic that's also being opened up on our facility. So we expect healthcare to grow fairly significantly on this campus. And we're certainly hoping that the demand becomes much higher than the capacity so that we can continue to grow.
If Summa doesn't acquire the pharmacy, will Neomed continue to operate as Rootstown Community Pharmacy?
We will we'll have to make those decisions once we see where we are with Summa. This is, I know things get out and discussions take place, but it's really quite premature. Summa has to finish taking a look at the due diligence on whether they wish to acquire it. That's a lengthy process of understanding what the business opportunity looks like, how it fits in with their new footprint here. And once they've made a decision, then we will inform the community, and we will have to make decisions as to what we will do going forward if they decide it's not in their best interest to do so. So again, very premature to be talking about the pharmacy at this point.
Do you know if chiropractic care will be available?
Right now, chiropractic care is not available, and I do not believe Summa Care is offering chiropractic care. The closest thing we'll have to that is the physical therapy program that's run out of the Sequoia region of the campus. And then, of course, orthopedics or advanced orthopedic care will be offered by Summa. But right now, there are no plans for chiropractic care. If you know of a chiropractor who's interested in opening up space on the campus, we do have space in the new center that's available.
Can you provide an update on the athletic fields that were cleared on the south side of campus?
Yeah, so those were developed and seeded. They are open and usable right now, but I spoke with Dale Fuchs, who told me that because of some of the areas where they pulled trees, there's been some sinking that took place. Then they're going to spend time filling those in to level them off, reseed those so that they'll really be fully available and safe for instance, athletic activities, for example, soccer. Probably next year, they'll be more ideal for that. Right now, they are open, and our employees, our staff, our students are certainly welcome to go out and make use of that space.
For those who have now been vaccinated once, second to follow soon, will weekly mandatory testing become less since masks are still being worn?
So weekly testing per the governor's directive that we received is not going to be required of those who were vaccinated. In fact, the new CDC guidelines state that those who have been fully vaccinated do not need to undergo asymptomatic testing. The governor did ask us to meet a particular percentage of the population quota, which is going to be for those individuals who've chosen not to be vaccinated or chosen not to show proof of vaccination.
There are no further questions.
Great. Well, thank you, Michael, and thank you to all of you for listening in today. Enjoy the summer months, be safe, and we're all looking forward to being back on this campus full-time in the new semester.
One question just came through.
Okay.
Does Neomed leadership have any plans in the short term or long term to hire a provost?
Well, in the long term, that is a likelihood. In the short term, no. If you mean short term, meaning this year, not this year. We do understand that there could be significant benefits from having a provost in place. The trade-off we have is the cost of hiring a provost. Given the level of individual we will hire, will add a substantial amount to our budget. So we need to do it at a thoughtful time once we've corrected the other internal areas around ensuring that our staff and our faculty are fully and appropriately compensated on this campus. Thank you.